So we have our guest speaker, Dr. Rashid. I'm honored to introduce Dr. Mehwish Rashid, Doctor of Health Science from Kaiser University, United States. Her expertise includes healthcare research, digital health innovation, healthcare policy, and data-driven healthcare solution. Her keynote presentation is titled Medical Marijuana versus Opioids Use on Epilepsy patients. We look forward to her valuable insights into advancement in healthcare research and treatment approaches. With that, let's welcome Dr. Rashid.
Medications to enlighten you. Hi, thank you for allowing me to enlighten you with my recent research on investigating perceptions of medical marijuana versus opioids. As we know, this is a very interesting subject given the current climate. Understanding how people perceive medical marijuana compared to opioids when it comes to managing chronic pain has always been an area that I was interested in. Chronic pain remains a major public health challenge, especially in regions like North Florida, where I'm from. Access to care varies, and patients often rely heavily on medications to function day to day. Traditionally, opioids have been primarily a good way to go for treatment for both moderate to severe pain, but their long-term use has led to serious issues such as dependency, overdose, and declining quality of life. Hence, the study focuses on these perceptions. We're going to further examine how individuals in North Florida view the effectiveness, safety, and long-term usability of medical marijuana versus opioids. We can better understand why patients choose one option over the other, or how healthcare providers, including policymakers, can support safer, more informed pain management decisions. There's been a paradigm shift in chronic pain management. Challenges and gaps in chronic pain treatment, efficacy, and safety research gaps. Study aims in regional focus health belief model applications. The study was necessary in how it fits into the broader conversation about chronic pain management. Over the past decade, there's been a clear shift away from relying solely on opioids because of the risk associated with long-term use. Things like addiction, overdose, decreased quality of life. At the same time, there's been growing interest in medical marijuana as a potential alternative, largely because many patients perceive it as a safer and more natural way to go about their pain. However, even though interest is rising, there are still major gaps in research. We don't have enough comparative data on how patients actually experience these two treatments, especially in regions like North Florida, where access, attitudes, and healthcare support matters. However, Taking all these effects and psychological influences that shape how people make their decision about pain management has played a major role in this research. The study also uses the health belief model as a framework. This helps us understand how patients weigh perceived risks, benefits, barriers, personal beliefs when choosing between opioids and medical marijuana. Chronic pain management has undergone a significant paradigm shift in recent years as patients, clinicians, and policymakers grapple with the shortcomings of traditional opioid based approaches and explore alternatives such as medical marijuana. Historically, opioids were widely prescribed due to their fast acting analgesic properties, yet their long term use introduced substantial risks, including addiction, tolerance development, and overdose potentials. These issues have contributed to a national opioid crisis, prompting the medical community to reevaluate pain management strategies. In contrast, medical marijuana has emerged as a potentially safer option, supported by reports of reduced dependence risk and improved patient satisfaction in recent contexts. This shift reflects broader societal changes, including evolving cultural attitudes towards cannabis, legislative reforms across U.S. states, and increasing patient advocacy for non opioid alternatives. Understanding this transformation requires examining not only clinical outcome but also patient perceptions, such as their beliefs about safety, accessibility, and the heavy stigma that influence the treatment choice. The comparison of the two reveals significant gaps in both efficacy and safety research, underscoring the need for comprehensive studies that address long-term outcomes and real-world patient experiences. While opioids have historically dominated pain management protocols, there are limitations including rapid tolerance development, physical dependence, and overdose risk have motivated research to explore alternative treatments. However, despite increasing public interest in state level legalization, medical marijuana research remains hindered by federal regulatory barriers that restrict access to study grade cannabis and limit the scope of clinical trials. So, as you know that the aim of the study is to evaluate the comparisons between the two, um, this regional focus is particularly relevant because Florida represents a unique intersection of medical policy, demographic diversity, and evolving public attitudes towards cannabis. Since the implementation of Florida medical marijuana program, patient enrollment has risen steadily, indicating growing acceptance and demand for non-opioid treatments. However, this rise occurs alongside persistent opioid prescribing, especially in rural and underserved communities where chronic pain prevalence is high and healthcare resources may be limited. So the study seeks to bridge a critical knowledge gap by capturing patient perspectives within this regional context, recognizing that treatment choices are shaped not only by clinical efficacy, but also by cultural values, local healthcare infrastructure, and varying levels of exposure to medical marijuana education. By comparing patient reported outcomes across both the treatment types, the research aims to uncover patterns that can inform public health strategies, provide training, and state policy adjustments. Additionally, focusing on North Florida offers an opportunity to explore how socioeconomic disparities, insurance limitations, and geographic barriers influence decision making. My research points out that the methodology relied on quantitative survey data. This approach made it possible to analyze patterns, correlations, and trends in patient perceptions, setting the stage for the key finding presented later in the slide. Moving forward, the study explores several critical research questions. For example, which treatment modality do patients perceive as more effective in managing chronic pain over time? And what factors contribute to these perceptions? Additional questions investigate how patients evaluate the comparative safety of each option, particularly regarding addiction risk, side effect burden, and long-term quality of life outcomes. The research also asks how accessibility influences treatment choice, recognizing that legal restrictions, cost considerations, and provider support may either encourage or limit adoption of certain therapies. Another key question addresses patient confidence in managing their treatment regimen, probing whether individuals feel more capable of using one option consistently and safer over the other or not. This study further examines the influence of stigma, social attitudes, and personal values on treatment decisions, seeking to understand how external perceptions shape internal evaluations. Finally, the research asks how demographic factors such as age, income, or health access affect perceptions and preferences. Collectively, these questions from a cohesive inquiry into a complex interplay of clinical performance, psychosocial influences, and structural barriers that shape chronic pain treatment experiences will matter. The study employs a quantitative survey-based methodology designed to capture patient experiences, treatment outcomes, and so forth. Participants were recruited from chronic pain population in North Florida, ensuring representation across diverse socioeconomic and demographic groups. The survey included validated measurement instruments assessing pain severity, functional status, quality of life, side effect burden, and perceived treatment effectiveness. Additional items measured health belief model, the constructs such as perceived benefits, barriers, susceptibility, and self-efficacy to better understand psychological factors influencing treatment choice. Data collection was conducted anonymously to encourage honest disclosure regarding medication use, stigma experiences, and personal attitudes towards the opioids and cannabis. So the methodology also accounted for potential co-founders, including previous substance use, comorbid conditions, and access to healthcare resources. Statistical analyses were planned to identify correlation between treatment type and reported outcomes, as well as to examine demographic patterns and the other social predictors of treatment preferences. The survey-based approach offers several strengths, including the ability to capture rich patient-reported data and compare perceptions across large groups. However, limitations include reliance on self-report, potential recall biases, and inability to establish causation. Despite of these limitations, the methodology provides a valuable foundation for understanding the real-world experiences and enhancing future clinical and policy decision-making. So, here we go. Patients consistently favor medical marijuana for quality of life and side effect profile, while opioids remain commonly largely due to cost coverage and familiarity. Perceived addiction risk strongly nudges preferences away from opioids. Meanwhile, stigma and access barriers still suppresses willingness to use cannabis therapeutically, especially in conservative or rural settings. Patients view medical marijuana as a viable, often preferable route for chronic pain management. It's safer, it's better, it's easier access to their daily functioning, while opioids persist due to system design rather than patient preference. So, the interpretation of patients and their perceptions was quite a complex interplay between clinical effectiveness and psychosocial influences and structural barriers in choosing between the two options. Overall, some patients said that medical marijuana is holistic and they felt like the overall results were better. There were fewer disruptive side effects and greater sense of control over their treatment. Their perceptions were shaped not only by personal experiences, but also by broader cultural shifts. that increasingly normalize cannabis use as a legitimate medical option. Meanwhile, patients favoring opioids often cited practically affordability and familiarity as determining factors, highlighting the importance of insurance coverage. So, affordability plays a big role in the long standing prescribing practices. Stigma emerged as a major influence, particularly for individuals in conservative or rural communities where marijuana use may still be viewed negatively despite medical legalization. Perceived risk also played an important role. While opioid users worried about addiction and cognitive impairment, some marijuana users expressed concerns about the psychoactive effects or legal uncertainties. These varied perceptions underscore that treatment decisions are not purely medically driven, but are influenced by values, beliefs, social identities, and community norms. Some of the recommendations for practice here were based on study findings. Several recommendations emerged from clinical practice, healthcare policy, and future research. For example, I feel the providers should integrate patient-centered communication strategies that acknowledge diverse perceptions, address misconception, and open the communication between the doctor and the dispensary and your healthcare provider and your healthcare insurance companies. Um, Educate people on medical marijuana, including dosing, product selection, and potential interactions. It is essential to providing evidence based guidance. Also, policymakers should consider reducing barriers to medical marijuana access by supporting insurance reforms, opening more dispensaries in rural areas, and making the quality of the product standard. Research priorities should include large scale longitudinal studies that directly compare the long term outcomes of opioid and marijuana therapies across diverse patient populations. And investigations should also further examine the substitution effect and evaluate whether marijuana can reduce opioid dependence or overdose risk. Qualitative studies exploring stigma, cultural attitudes, and decision making cues may offer deeper insight into the psychosocial aspect of treatment choices. Additionally, studies should consider the role of socioeconomic disparities as financial and geographic barriers significantly shape patient options. Together, these recommendations support a more equitable, scientifically informed chronic pain treatment landscape that can balance clinical efficacy and patient experiences and their priorities. I would like to take just a few minutes to go over some quick conclusion and implications as the study findings underscored the growing importance of understanding patient perceptions in chronic pain management, particularly as medical marijuana gains traction as a potential alternative or complement to traditional opioid therapy. Results indicate that many patients perceive medical marijuana as offering improved quality of life, fewer side effects, and lower addiction possibilities, while opioids remain entrenched due to accessibility, provider familiarity, and insurance coverages. These insights highlight the need of healthcare system to prioritize patient-centered approach, address structural barriers, and ensure that both treatment options are presented with clarity and evidence-based guidance. The application of the health belief model further emphasizes that attitudes towards risk benefit, stigma, and self efficacy significantly shape treatment decisions, enforcing the importance of holistic assessment in clinical practice. As policymakers and clinicians navigate ongoing changes in cannabis legislation and opioid regulation, the perspectives captured in this study provide a valuable foundation for improving patient education, refining treatment guidelines, and fostering compassionate, informed care. Ultimately, acknowledging and integrating patient experiences is essential to advancing effective, ethical, and sustainable approaches to chronic pain management.